let's take a look at some abbreviations of the urinary system and how you might see them in some of your clinical notes. Okay, first up is the term UA, so just a capital U and A, or you might see kind of a backslash through the center of it, so U with the backslash and the A. Just depends on who's writing it and how they learned it. But that is the term for a urinalysis when we sort of take a look at the components of the urine. Next up is UTI. Again, generally all capitalized. This is on your word list if you want to look this up to see what it means. But it refers to a urinary tract infection, which is fairly common in the medical practice. Next up is an IV, which refers to anything that is given intravenously, so given inside the vein. Okay, SG, a capital SG is how you normally see this. This refers to specific gravity, which is how we look at water versus other components inside the urine. Our next abbreviation is CRF. CRF. See if you can find what this one means on that word list. All right, CRF stands for chronic renal failure. What about ARF? ARF. We saw this one in that disease unit. If you need to watch that video, go ahead and watch that video. But that stands for acute renal failure. What about CKD? CKD. See if you can find what this means according to your word list. Okay, hopefully you found it. It stands for chronic kidney disease. And last up, ESRD. See if you can find that one on the word list. All right, ESRD stands for end-stage renal disease, meaning that we're about to head into kidney failure, right? So it's the very last stage before our kidneys stop working. All right, there's a few more abbreviations on your word list. Make sure that you memorize them all. Okay, but these are some of the most common ones that we found for the urinary system.